Welcome to Dede Watara. Paul Grafe, your host on this Thursday afternoon, October the 15th at K1037 Kahnawake. And we do have a very special show for you today. Our first guest will be Dr. Jane Philpott, who, of course, the former health minister in Canada and the first Indigenous Services minister, is now the Dean of Medicine over at Queen's University, a job she's only been in since July, but she's a former family physician. And we will hear from her in the first part of the show. In the second part of the show, we will replay the interview with the COVID-19 Task Force, Lisa Westaway and Lloyd Phillips on Kahnawake's K1037. So let's get to that interview with Dr. Philpott. The Honourable Dr. Jane Philpott is a former federal Minister of Health and Minister of Indigenous Services in Canada. She is now the Dean of the Faculty of Health Sciences and the Medical School at Queen's University, and she joins us today on Dede Watara on Kahnawake's K1037. Dr. Philpott, thank you for joining us today.
Well, thanks for inviting me.
So the news across Canada that hit 2 weeks ago was the tragic death in Joliet at the hospital there of 37-year-old Joyce Echaquan. And you reacted quite quickly to this, despite being Dean of Medicine over at Queen's University. As former Indigenous Services Minister, this probably brought up a lot of feelings for you.
Well, it's a terrible, tragic story, and first of all, just want to express my sympathies to the family and the community who are so deeply impacted by this. But like you, it didn't come as a shock, unfortunately, because we know the extent to which racism exists in multiple systems. You know, healthcare is not the only area of systemic racism. We see the same thing in criminal justice system and in law and in the educational sector, across the board. But in healthcare, there have been tragically more than enough examples of where it has actually been fatal in cases like this. But there are, for that, many countless other cases where people experience racism, and it has to be called out. I mean, we have to stop denying it. There are clear paths as to what has to happen, and I saw that as an opportunity to put my voice in the conversation and say, now in a different role, there's still an enormous amount of work for governments to do, but it's not just governments. The TRC calls to action make it very clear that educational institutions, especially those that train health professionals, have a big role to play. Well,
yeah, you wrote an article in MacLean's dated October 7th where you outlined a lot of this, and I want to get a little bit more to what you about that and what you said in just a second, but you mentioned systemic racism, and so many people would agree with you, except for the Premier of Quebec where this happened. I mean, how frustrating is that to hear that he still does not acknowledge systemic racism despite the TRC, despite MMIWG, and despite the Vian Commission report, which his government has done very little on?
Well, I don't want to try to explain why a particular person would not be understanding of what's going on in systems in their jurisdiction, but you have to just sit with racialized people for a few conversations and ask them what their experience is when they go into hospitals or when they encounter healthcare systems. And it doesn't take long for the stories to come out. And, I had, of course, the incredible privilege as Minister of Health and Minister of Indigenous Services of spending a lot of time with First Nations, Inuit, and Métis in this country. And as I said, if you ask the question, you will get the answer. You will hear the stories. It happens every single day right across this country that people are discriminated against on the basis of their race. We have to name it, and then we have to do the work to first of all, dramatically diminish the racism and ultimately aim toward elimination.
Yeah, that's not a step that obviously can be done overnight. It's got to... in my estimation, it has to start with younger people so that change could come across like a wave to the future, correct?
Well, it has to start with younger people for sure, and I think it does happen to a certain extent. But it's challenging for people who are raised in privilege to sometimes acknowledge their own privilege, and it needs to be put in front of you. People often think that they got where they got, because they, worked harder than anybody else. But for people who have grown up in privilege to realize, no matter what your age, that there are reasons why some of us have been able to get an education and have been able to get access to good health care. And it's not earned privilege. It's on the basis of unearned advantages that some people have in this country. And the sooner that we all start to acknowledge that, the better.
A great book to read, I think, would be Outliers, Malcolm Gladwell, where he talked about privilege and how some really famous people have earned through hard work, but because they were based in privilege first and earned their spots in life, including a Bill Gates. But I want to get to what you've written in your opinion piece in MacLean's. You wrote, quote, Joyce Echaquan is not the first person to die as a direct or indirect result of racism in the Canadian healthcare systems. Tragically, she won't be the last. Those are very powerful words.
Well, the reality is that this was a very obvious case in terms of the way that she was treated or not treated, as the case may be. But there are so many more subtle ways that people are victims of racism in terms of lack of access to care in the first place, all of the barriers, geographic, physical, financial, and so many other reasons why people don't get the care that they need in the first place, and or the follow-up, and there's a long list of reasons why racism affects people's interaction with the healthcare system. One of the things I pointed out in that article is that the TRC speaks specifically to the training of health professionals and the fact that a number of racialized groups, including Indigenous peoples, are dramatically underrepresented in health professions, human resources in health systems. And I think that's part of the problem. Is it's not just who's actually delivering the care. It's not just the kind of care that's being delivered, but it's also who's delivering the care.
We are joined by the Honorable Dr. Jane Philpott, who is the Dean of Medicine, essentially, at Queen's University now, and, of course, former Indigenous Services Minister, former Health Minister of Canada, as well, on Dede Watara today. How aware were you, when you were serving as a family doctor in the Toronto area at the beginning of your career, of these issues with Indigenous communities?
I would say not as aware as I should have been, perhaps. I lived and worked in a part of the country that has a very low percentage of the population who identify as First Nations, Inuit, or Métis. I was aware of racism more generally, having spent a good chunk of my career in the early days working in West Africa and having a broader interest in terms of from a global health perspective. But in terms of racism against Indigenous peoples, it certainly came very dramatically to my attention in my role as Minister of Health, first of all, and then in Indigenous Services, where I saw the rampant impacts. But it wasn't something that I would say was a topic of common discussion in healthcare circles, and hopefully we can make it that way in the days and weeks to come.
I remember, when you were Minister of Health, you had to deal with the crises that were, really developing in First Nations communities and Indigenous communities, including the deaths by suicide in Attawapiskat, the violence in Lelouch, Saskatchewan. Were you able to affect any permanent change at the time in order to get, the government to react properly so that there would be measures put in place that would last?
Well, I think that there was some progress made during that time by calling attention to these issues, certainly as it relates to the number of suicides in communities in Northern Ontario, for example. Anishinaabe Nation was able to put together a youth-designed, First Nations-led program called Choose Life that's funded through Jordan's Principal funding that's been, I think, really effective in terms of addressing some of the mental health and cultural supports that young people need in those communities. I think the other one that I would draw attention to, which I feel is a positive sign of progress, and I think it's a racism issue, is the matter of the severe over-apprehension of Indigenous children in the child welfare system. And we see that interacting with the healthcare system when babies are apprehended at birth in many parts of this country, often as a direct or indirect result of racism. And in places like Manitoba and Ontario, for instance, that common practices like birth alerts have been now taken out of the system, and we were able to also enact a law that recognizes the rights of Indigenous peoples as it relates to child welfare. But those. Again, these are entrenched, deeply long-standing problems that don't get fixed overnight.
Well, no, certainly not. I mean, it took residential schools many, many years in order to eliminate that system, and the effects still being felt, and of course, the 60s scoop as well. Yeah, for sure. And as you know, the rates of apprehension of children are still extremely high, and they will have intergenerational effects. But that's not to say that we mustn't continue to press for dramatic changes and stop taking children away from their families. We talked earlier about the things that young people kind of have to lead the way. But sometimes they obviously need direction. And in education, as dean of the medical school and of the Faculty of Health Sciences, you're already putting in some measures in order to get that done at Queen's University.
Yes, we are. And, again, as you and I have already talked about, it's going to require comprehensive reform of institutions. But I think many of the steps are very clear as to what has to happen. One of the things we're working very hard on that I want to make sure your listeners are aware of is the recruitment of both students, faculty, and staff in our health sciences faculty here who come from, who identify as First Nations or Inuit or Métis. And I think, I encourage any of your listeners who are interested in a career in health professions to consider Queen's University. We're really we are putting in place a whole suite of reforms to be able to make it easier to overcome what have been the structural barriers to access to, say, medical school, for example, but also recognizing that supports need to be in place so that people that may find challenges coming to a community where they are very much in the minority will have the supports that they need with an elder in residence and making sure that there are also educational supports for people who come into medical school, and we want them to be successful. So we are doing a lot in the way of recruitment, mentorship, support, changing our curriculum, doing a thorough overhaul of curriculum as directed by the TRC, and hopefully over time we will really start to see that institutional change.
Dr. Jane Philpott joining us on the line from Queen's University today on Dedewatara on Kahnawak's K1037. I'd like to read something back to you as well from the MacLean's piece that you wrote. Indigenous peoples must see themselves reflected in the health professionals who treat them. That's the quote. In Kahnawake, we're fortunate here because we have the Kahnawake Memorial Hospital Center, but it's not many of Canada's First Nations communities that have their own hospitals and have people like themselves treating them.
That's for sure. It's certainly you look at a place like Kingston where there's not necessarily a high incidence of First Nations living in the community, although there are some, and we have neighboring communities of both Tyendinaga, just less than an hour from here, and Akwesasne a little bit further than that. But we also are an area of referral for some of the James Bay Coast communities who are flown in here from Moosonee and Moose Factory to get their care. And if they don't see people or know people that will either understand their culture or speak their language, it can be, first of all, an overwhelmingly difficult cross-cultural experience, but also people are often vulnerable to being misunderstood, and of course the case that took place very recently in Quebec is a terrible example of what happens when somebody experiences that kind of discrimination.
Unfortunately, we see so much of that in Montreal as well. I mean, there were cases of children who were being flown from Inuit and Métis communities to Montreal for medical treatment and weren't allowed on the plane with their parents until that was changed a couple of years ago only. You were health minister when the Liberal government came aboard in 2015. In 2017, you were named the first Indigenous Services Minister. Was this a job that you, at the time, pushed for, that you wanted? Why why do you think the Prime Minister named you to that job at the time?
Well, when I was Minister of Health, the way that the federal government structures were at the time was that the First Nations Inuit Health Branch fell under the auspices of Health Canada. But you may recall that the Royal Commission on Aboriginal Peoples, which was I think quite an excellent report that was tabled, we're getting close to 25 years ago now, and many of the recommendations of that report, of course, have not been implemented. But one of them was that the report recommended, on the basis of extensive consultation, was that there should actually be two departments or ministers in the federal government, one which had a long-term establishment of the relationship between the Crown and Indigenous peoples, and that when, in fact, Indigenous rights are fully respected and people actually can fully exercise the right to self-determination, including self-government, that there would not be a role ultimately for the federal government in terms of some of the delivery of services like education and health care that the federal government currently plays a role in. But that until that time, that there needed to be a separate minister who dealt with some of those services like child welfare, education, health, infrastructure, etc. And so that was a decision that I think, was something that was a big part of why Prime Minister Trudeau at the time decided to establish that new Department of Indigenous Services. And because I had already had some involvement through my work in the health portion of it, I was moved over there. And I must say, much as I loved being health minister, I'm very grateful that I had the opportunity to be Minister of Indigenous Services. It was a strong educational experience for me, but I hope that I was also able to have an impact in terms of improving some of those services.
Of course, it's been covered so much, you resigning back in March of 2019 in the wake of the SNC-Lavalin affair and how Jody Wilson-Raybould was treated. But quickly, I want to talk about, or I want you to talk about how, if this Liberal government has done enough or is doing enough and headed in the right direction in terms of handling Indigenous communities and Indigenous affairs.
Well, I think things got off to a good start, I would say, back in 2015. There have been a number of reasons why things have been sidetracked, and I guess that happens to many governments along the way. Of course, the biggest thing in the past year has been this pandemic, which has taken everybody off of their priorities. I think there is work happening quietly behind the scenes in terms of ongoing work around negotiating self-government agreements that is really critical to be able to address the long-standing roots of the problems that you and I have been talking about in terms of the denial of rights of Indigenous people. So I think it's going to continue to be hard for the short-term future to be able to keep that on the radar, but I certainly hope, some of the promises that have been made through speeches from the throne, for example, around new areas where there would be legislation to recognize and respect those rights. I hope that will increasingly gain the attention of the government.
Dr. Philpott, I know we're out of time. Thank you so much for joining us today, Nyalgoa.
Well, thank you so much for having me.
Dr. Jane Philpott, Dean of Medicine over at Queen's University, former Health Minister in Canada, first Indigenous Services Minister as well, joining us on Dedewa Tarak.